A silent struggle: mental health in Africa. Mental health is a global issue. It affects millions. In Africa, it is a silent crisis. 1 in 8 people in Africa suffers from a mental health disorder. This includes depression, anxiety, and PTSD. Poverty, conflict, and diseases play a role. Stigma is another major challenge. It prevents people from seeking help. The consequences are severe. We must break the silence and provide support. Poverty, conflict, and inequality fueling the crisis. Poverty is a major contributor to mental health issues in Africa. Living in poverty creates stress, anxiety, and hopelessness. Lack of access to basic needs such as food, water, and shelter takes a toll on mental well-being. Conflict and violence also have a devastating impact on mental health. Exposure to trauma, displacement, and loss can lead to PTSD, depression, and anxiety. Many African countries have experienced prolonged periods of conflict. This leaves deep scars on individuals and communities. Inequality is another factor that exacerbates mental health problems. Social and economic inequalities create divisions within society. This can lead to feelings of marginalization, discrimination, and lack of opportunity, all of which contribute to poor mental health. Historical scars, colonialism, and its lasting impact. The historical context of mental health in Africa is complex. Colonialism has left a lasting legacy on the continent's mental health landscape. Colonial policies often disrupted traditional support systems. They imposed Western values and beliefs that stigmatized mental illness. This disruption contributed to the erosion of traditional healing practices, the forced displacement of populations, and the exploitation of resources during colonialism also had a profound impact on mental well-being. These experiences created intergenerational trauma that continues to affect communities today. Section 4. Faces of the Crisis: Stories from the Continent. The mental health crisis in Africa has many faces. Each country and each individual has a unique story to tell. In Kenya, for example, the high rate of youth unemployment is a major concern. It contributes to feelings of hopelessness and despair among young people. This has led to an increase in substance abuse and suicide rates. In South Africa, the legacy of apartheid continues to cast a long shadow on mental health. Despite the end of racial segregation, many people still experience trauma and discrimination related to their race and ethnicity. In Nigeria, the Boko Haram insurgency has displaced millions of people. It has exposed countless others to violence and brutality. This has resulted in a surge in cases of PTSD, depression, and anxiety. Section 5. A System in Need: Challenges in Mental Health Care. Africa faces significant challenges in providing adequate mental health care. These challenges include: first, the lack of investment. Mental health services are chronically underfunded in many African countries. This lack of investment results in a shortage of trained professionals, limited access to medication, and inadequate infrastructure. Second, stigma and discrimination. Stigma surrounding mental illness prevents people from seeking help. It also creates barriers to accessing quality care. This stigma is often deeply ingrained in cultural and societal beliefs. Third, the lack of awareness. There is a general lack of awareness about mental health issues in many African communities. This lack of awareness prevents early detection and intervention. It also contributes to the perpetuation of harmful myths and misconceptions. Section 6. Seeds of Hope Towards a Brighter Future. Despite the challenges, there is hope for improving mental health in Africa. Several initiatives are underway to address this crisis. Community-based mental health care is growing, training health workers to support individuals with mental health issues, integrating mental health into primary care settings, reducing stigma and discrimination, public awareness campaigns and educational programs, investing in research to understand specific challenges. By investing in mental health care, reducing stigma, and empowering communities, we can create a brighter future for all.